Hello everyone, welcome to sqadia.com. Today the topic of our lecture is the stress reactions and the somatoform disorders. So when we talk about the stress reactions, it basically depends upon the factor. The severity of the trauma is going to determine the stress reaction that the certain individual is going to go through. So that is basically what we're going to talk about in this lecture. The post-traumatic stress disorders and the other somatoform disorders that basically physically manifest themselves in a particular individual are again very important, and they have their own significance while we have this psychiatric clinical assessment of a patient. In the first section, we'll be dealing with the acute stress reactions. So basically, any person can react to the stresses that are surrounding him. Now, the normality or the functionality of these stress reactions are again very important. If they're hindering a person's lifestyle, if they're hindering his functionality, and he's being affected in every way of his life, then it's basically kind of pathological, and it needs some intervention as well. So we're going to determine the important factors that are going to affect a person individually over here in this section. The symptoms of the acute stress reactions, it can basically variate from normal panic disorders that include the sweating, the tremors, and the thought continuity is going to be affected in such ways, as well as the thought content is going to be affected. He's going to be more pessimistic in his thoughts while he's having those stress reactions. So again, the management is very important, and it depends upon the severity of his functionality being affected. If the person is affected very severely in his day-to-day life, then we need some pharmacotherapies as well, along with the CBTs that basically includes the cognitive behavioral therapies. So we'll be including the whole management starting from the history to the treatment guidelines as well. In the second section, we'll be focusing on the post-traumatic stress disorders. So it is a whole symptomatology, it is a group of symptomatology, and this syndrome is again very important. People usually suffering from severe stresses ranging from the rape cases. It can be a severe trauma that involves the close relatives, the parents, and the siblings as well. So the person will relate to this trauma, and he's going to show a particular kind of group of symptoms, which is usually termed as post-traumatic stress disorder over here. So that basically includes the clinical features. And then we'll move on to the diagnosis in these cases. What are the guidelines for the diagnosis in the post-traumatic stress disorders in most of the cases? Then the management. Management guidelines are again quite defined by the ICD. There is an international classification for these post-traumatic stress disorders. And again, the treatment guidelines depend upon the diagnosis. So we'll take a complete history, and after the diagnosis has been made, we'll start off with the CBTs as well as the pharmacotherapies in these cases as well. In the third section, the adjustment and the dissociative disorders. So basically, the dissociative disorders means when the person unrelates to the reality that is surrounding him, and that is quite unhealthy for the person as well, and his functionality is also affected in these cases. So these dissociative disorders mainly will be discussed in this fourth section. In this third section, the manifestations are again very important, and we'll move on to the managements in these adjustment disorders whenever that is usually seen obviously in the adolescence and as well as in the childhood cases. And as well as we'll be discussing the dissociative disorders along with these adjustment disorders in this section. Obviously, the management guidelines, there are a lot of similarities between these two. So we'll be discussing them together in this section. And then we'll move on to the risk factors. So there are a lot of personalities that are prone to such conditions. So we'll be discussing the environmental and the basic risk factors involving these conditions. The prognosis in such cases will be discussed also in this section. In the fourth and the final section, we'll be discussing the somatoform disorders. So we've already discussed there is a close correlation between the psychiatric evaluation and the physical condition of a person. So the physical condition of a person is usually affected on how he thinks, what is the psychiatric evaluation of that person. When we perform that MSE, that basically involves the mental state examination, we come to a point that we know what are the physical ailments due to. So the etiology sometimes lies in the psychiatric evaluation over here. So we'll be discussing the manifestations along with the management of the somatoform disorders over here, and the risk factors as well as the prognosis of such a condition will be discussed in this fourth and the final section. So I hope you want to learn more about these stress reactions as well as the somatoform disorders. So do watch the other sections for this lecture as well.